Hello everyone, this is Katherine Cox and I will be your guide as we journey through the perfect Medicare annual wellness visit at Rochester Academic Family Medicine. To begin this process, the front desk will be responsible for scheduling Medicare annual wellness visits, as well as documenting the correct billing code for this year's Medicare annual, along with the month and year that this is current through, in the patient's sticky note. Additionally, they will print our new and improved health risk assessment form and ensure that the patient's name and date of birth is documented on this form so it can be appropriately scanned into the chart at the end of the visit. Additionally, once the patient has checked in, they will provide both the HRA and five wishes document at check-in. From there, our lovely medical assistants will take over, ensuring that the correct template has been selected, which you can see here. Medicare annual wellness visit with no other bells or whistles there. They'll make sure that to take their vital signs per usual, most important being blood pressure, height, weight, and BMI, ensuring that the HRA is completed, and then at the end of the visit scanned into the patient's chart. And then per usual, the history review, social history, making sure we're noting if patient is a smoker or drinker, performing a thorough medication reconciliation, checking on quality measures, and then it is paramount that these 3 screenings are performed in order for us to be able to bill a Medicare annual, including the PHQ-9, the Morse Fall Scale, and the Audit C. From there, our physicians will take over, and part 1 being that they ensure that the appropriate template is in use, that these screenings were completed, and that the patient has completed the HRA and that you are reviewing that and addressing any issues that has uncovered as far as ADLs, etc. And then again, at the end of the visit, ensure that this is returned directly to your medical assistant so it can be scanned into the chart. And then from there, you're going to complete the Medicare annual wellness visit per the template, which we will review shortly. For your review, here is a flow chart depicting each category's responsibilities. And from here, let's do a practice patient, everyone's favorite, my test. At this point, the intake will have been completed by our lovely medical assistants, which we can see here, the patient's vital signs, and that these screenings have been completed. Medications problem lists have been updated. Vital signs available for review. And from here, our medical assistants at front desk can exit the video. We appreciate you for all you do. And we will begin the template. So fortunately, I have chart prep for this patient, which is always a great idea when we're dealing with any type of visit, but especially a Medicare annual. The first part, we will review demographics for the patient. Race is addressed in the HRA. Here we have age and gender. We'll review any chronic conditions that the patient has, in this case, hypertension being one. We have reviewed her surgical history in the chart, which was updated by our lovely medical assistants here. We can see that she's had an appendectomy and hernia repair. Social history, we know that this patient is a former smoker. We'll confirm this with the patient, quit 5 years ago and has around 10 pack years. Patient is deemed herself a non-drinker per the Audit C and denied any illicit drug use. Family history is available for review in the chart, which we will verify with the patient. And then medications include hydrochlorothiazide. From here, we will go through the screening and prevention schedule per Medicare recommendations, and that includes things like blood pressure, every visit, lipids. This is done every 5 years unless there is an alternative diagnosis such as CAD or hyperlipidemia. In this case, the patient had normal lipids completed in her Welcome to Medicare annual wellness visit in 2021. Colon cancer, patient had a negative colonoscopy last January and is due for repeat in 10 years from then. Diabetes screening, a Hep C, HIV, all completed at her Welcome to Medicare. Does not qualify for lung cancer screening. She's going to get her flu shot today. Has a pretty healthy diet where we kind of go over that she's getting adequate servings of fruits and vegetables and is not using any vitamins or supplements. Exercise, physical activity, she's very active at the OPC, getting her freak on there, 150 minutes per week, alternating strength and cardio, denied any issues with hearing and vision. And then for any other issues with the IADLs or ADLs, you'll see the HRA, and any issues that are brought up there you can address here at this portion of the HPI. We'll take this out because our patient is female, and from here you can see osteoporosis, breast cancer, cervical cancer, etc. has already been addressed. In the review of systems, this is where you will briefly touch on advanced care planning as much as the patient would like to visit the 5 wishes document. In the state of Michigan, if this has been signed by 2 outside witnesses, not in our clinic, this is considered a legally binding advance directive. I think it's a great idea to at least start the discussion, including things like code status and a medical decision maker if the patient is unable to make their medical decision, so that this is documented in the chart. Additionally, it is important to update their care team with any specialist that they are seeing other than yourself. In this case, the patient sees Dr. Pradhan as our cardiologist, so we have that there. Moving on to memory and cognition. So if you feel like from your interaction with this patient during their Medicare annual wellness visit that they do not have any gross memory deficits, you can simply check this box and be done with it. If, however, you do have some concerns about the patient's memory, you can then move on to screeners such as the Mini-Cog, the MoCA, or the SLUMS, whatever your preference is. Next is if your patient is using opioids, this section needs to be completed. In this case, Miss My test here does not use opioids. Next is whatever portion of the physical exam you do complete. This is technically not a requirement for a Medicare annual, but I think it's a good idea to always examine your patients at their annual exams. And then from here, we'll have a few patient education materials that we have auto-populate there, their BMI, their chronic disease management, and documenting that they're controlled, etc., and your game plan for them. And then any screenings that they're due for. So in my test case, she's going to be due for her mammogram in January, so we're going to go ahead and order that for her, and then she's going to get her flu shot today. And from there, we will move on to billing. So in this case, we can see in the sticky note that patient is due for her G0439. So this is your subsequent Medicare annual wellness visit. And once they have hit this, this is the one that they will be billed perpetually from then on. And we'll make sure that all of these important Z codes are documented. We will make sure to bill for our flu shot, which in the case of Medicare, they have their own G codes for. And then we'll fill out our screeners. So that will include the PHQ-9, which was negative. If you forget what that is, you can simply click on it and see there it's 0. Morse fall scale 3288F, documenting that the fall risk has been documented. And then audit C. Again, if you forget, you can click on it, see that she's negative. And then from there, you are done with your Medicare annual, and it is ready to be sent to your preceptor. Thank you for joining me, and please let me know if you have any Medicare annual related questions.